Some patients will come to you with lots of seborrheic keratoses and they're stuck on appearance. This is one lady's treatment journey. First, let's look at the dermoscopy to confirm our clinical impression. They're all well demarcated. There's some surface scale, but no obvious milia or hairpin vessels showing up on the fused dermal papillae ridges. Ultraviolet light shows up the keratin in the fissures very nicely with this lovely blue colour. Beautiful, or is that just me? Younger seborrheic keratoses show the classic developing fissures and ridges pattern, which will evolve with time. Another has a few milia showing up white on non-polarized dermoscopy. All are very similar in nature, and I could find nothing atypical or an ugly duckling on her skin to worry about. What would you do? You could say, don't worry, they aren't cancer. They will never become cancer and are just a nuisance. Choose your parents more carefully next time. But they were really irritating her, so I offered to treat her with cryotherapy. And after discussion and verbal consent, we started a first treatment cycle. I never go over a 30 seconds freeze. You use little pulses of spray to the centre of the lesion, and as soon as it's frozen, you start your timer. Here's how she looked at the end of the first session. 3 weeks later, some had already dropped off. Note the erythema halo and paler centre. I always warn my patients about this pigment change. Melanocytes tolerate freezing very poorly and depigment the skin. This colour change will improve with time. Bear this in mind in patients with darker skin types. Removing the seborrheic keratoses is primarily to stop the irritation and make the skin feel smoother. I proceeded to treat some of her other seborrheic keratoses, and a month later, this is how her back looked. She was very happy with how her back felt. It was no longer irritating and much smoother for her. We could treat more of her seborrheic keratoses, but this treatment will keep her feeling fine for a number of years. Now you could do that for your patients, couldn't you?